Have you ever thought about getting a blepharoplasty to the upper lids, but you weren't sure what the recovery was meant to be like? Hi, I'm Dr. Dominic Castellano at Elite Facial Plastic Surgery, and today I'm going to talk to you about the recovery when doing an upper lid blepharoplasty. So typically on your day of surgery, you'll have your procedure, and then once completed, you'll have sutures that are running in the upper lids. These sutures are normally going to be a running knot where it's kind of like a baseball stitch going through the skin. Some surgeons may opt to do what are called subcuticular, where the suture goes below the skin. Others may also do interrupteds or a combination. You can see there's different ways to close the skin. However, post-operatively, what you're going to do, especially the day when you get home, there should be some ointment, an antibiotic ointment, preferably over the incision line to help protect the skin and facilitate the healing process. I would also encourage you to make sure you don't put too much on because some of those ointments can be irritating to the eye. So you just want a very small amount to keep a very light sheen or coating on there. After your first day on post-operative day 2, you may notice a little bit more swelling. Sometimes that can be swelling without bruising, or it can be a combination of the two. Bruising during your recovery period is normal. However, if you notice excessive swelling, significant bulging, certainly any pain, you should let your surgeon know immediately. But most patients are normally going to have a mild amount of swelling. You should be able to open your eyes and see. Certainly if you have any problems with your vision, let your surgeon know. But then after that first day, you're going to want to clean the incision with a little bit of peroxide. Ideally, maybe use a Q-tip because that's a little bit finer. And then after you remove a little bit of the crusting, put a little bit more ointment on there. Now, post-op days 2 through 7, you're kind of repeating the same thing. I think you'll find that you won't have as much crusting every day that moves forward, and you'll be able to see those sutures pretty clearly. Now, on your 7th post-operative day in my practice, I normally start to remove what I call the interrupted sutures at various tacking points, and then I'll also typically cut the knot on that running suture. And normally that knot's going to be out on the side over here, and also here more immediately. Depending upon how much swelling you have and how you're healing, I may keep that suture in a couple more days or even another week. Normally what happens once those knots are cut, as the body continues to heal, those sutures will start to pull out a bit as well. Many times I'll have patients trim that on their own, but then when I see them in follow-up after their first post-operative day or first post-week on day 7 to seeing them back on either post-op day 10 or 14, I'll remove the remaining suture that's present. From that point moving forward, you're going to see that the incision has a little bit of a pink color to it, which is very normal. That pinking will take normally about 6 months to fully mature. During that maturation process, I encourage patients to wear a small amount of sunscreen along the incision line, especially if you're going to be outdoors for an extended period, and to certainly wear a hat. After 6 months that the incisions are mature, during that maturing process, some patients can also put things like Mederma, vitamin E. Those are certainly reasonable. But at that point in time, the incision will continue to mature, and ultimately, if the incision is placed in a good location, it should be barely visible, if at all. So what's recovery like with a lower lid transconjunctival blepharoplasty? Now, compared to the upper lids where you're making an incision through the skin on the top, with the transconjunctival approach, you're making an incision behind the eyelid. In doing so, there are no sutures that are normally placed. That's the benefit of doing the lower lid blepharoplasty surgery. However, the day of the procedure, just like the upper lid blepharoplasty procedure, you're going to have a little bit of swelling in the lower lid area. That's very normal. That first night, you could have a little bit more swelling to where it's a little bit soft and puffy, but certainly if it becomes very prominent, excessively bruised, you have a bleeding, any pain, any problems with vision, you should let your surgeon know. On post-operative day number 1 after that lower lid procedure, there's really not much you need to do because again, the incision is behind the lids and it should heal up very well. I usually tell patients, more importantly, is to take it easy while you're recovering, just to help facilitate your body resorbing the fluid and also facilitate the healing process. Now, if you have had some laser resurfacing done to the lower lids, which is often done in my practice, you'll be applying ointment on and off the skin that first night every 4 to 5 hours, and you'll continue that process till you follow up 1 week later. At your 1 week follow-up, I normally will transition you from putting what's called Aquaphor on the skin to more of a moisturizer and what I like to refer to as post-resurfacing care. At that point in time, you'll continue that post-resurfacing care as you follow up. Normally, the follow-up intervals for both the upper and the lower lid blepharoplasty is going to be post-op week 1, post-op week 2, and then I normally see you back 2 weeks after that for your 1 month checkup. Now, in some instances with the lower lid blepharoplasty and the patients who have had laser resurfacing, you can sometimes develop what's called hyperpigmentation or dark tanning of the skin that has been resurfaced. In some instances, you will need to be placed on a prescriptive cream to help reverse that and slow that down and get the skin back to its normal tone. It's not uncommon, and it's called post-hyperinflammatory pigmentation. So from a recovery standpoint, most patients are often inquiring as to when they'll be, quote, fully recovered from their blepharoplasty. So that's kind of a tricky question because it's not like a light switch where it's just on 1 minute and off the next. The healing process with anything that we do in facial plastic surgery is just that. It's a gradual process. However, with the upper lid blepharoplasty, usually I'm recommending patients kind of evaluate things in periods of weeks. As you'll see, the first week, you're caring for the site. The sutures come out after about a week, up to 2 weeks. And then once the sutures are out, that incision line takes time to fully mature. And any incision on the face area takes about 6 months to fully mature. But what I tell most patients is give that upper lid blepharoplasty a good 6 weeks to kind of allow things to settle. Because during that time period, even though as the incision is maturing, you're going to still have a little bit of swelling, especially in the upper lid area, as the area is trying to recreate what are called the lymphatics to help continue to drain fluid. So as a rule of thumb, I would tell you to judge your upper lid blepharoplasty at 6-week intervals. Usually by 3 months, the swelling is resolved. However, the incision will still be maturing for another 3 months to give that 6-month time period for incisional maturation. How long will it be before you see full results from your lower lid blepharoplasty? As with the upper lid blepharoplasty, it's kind of a gray area from the standpoint that it's not like there's one hard set rule. What I usually tell my patients is follow the healing process over a period of weeks. I normally tell most patients give it about a good 4 to 6 weeks before you're really seeing a lot of improvement from a swelling standpoint, and then every 6 weeks thereafter, and usually by 3 months, you're starting to see what the lower lids are going to look like, and then from 3 months to 6 months, there may be a little bit of residual swelling that resolves. But unlike the upper lid blepharoplasty where there's an incision up in the skin crease, normally with the lower lids, because it's mucosa, it tends to heal a little bit quicker. What are some things you should look for that you need to contact your doctor? First of all, what I would say is that if you have swelling with pain, any vision issues at all, you should definitely contact your surgeon immediately. If you have any excessive bleeding, for instance, to where it's associated with also swelling and any discomfort at all and problems with vision, I would definitely contact your physician. If you're having any pain at all, then I would certainly contact your physician so that way they can guide you through the healing process. When it comes to the upper and lower lids, if there is any swelling, it's a confined area, and you really should contact your surgeon if you have any questions or concerns. Don't hesitate, because it's important for your surgeon to know what's going on versus you trying to not bother somebody.